Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning, Dr. Mencia.
Anita.
And
how
we're
are
so
you?
happy to have you here.
So happy to be
always.
here. It was one of those sleepless nights.
Sleepless nights.
Yeah,
the moon. I heard that the moon.
Oh, it's so beautiful.
It was huge.
Oh, it is still huge. It's still out there.
And they say there's
waiting
something
for you.
special, right? Something special about it, isn't it?
Yeah, it's
I don't know
beautiful
what it's
moon.
doing.
It's beautiful.
It's the first something. I don't know. Somebody.
Yeah.
There's a big thing written about it, but.
The 24 was the Prophet Muhammad's birthday. So it was, I guess, it was not only for Christianity a big day, for Muslim around the world. It was also a big day of prayer and educating the community of what their religion is all about. The true religion, not what we getting exposed to.
Yeah.
And today is the beginning of Kwanzaa.
And I don't know much about that.
Very interesting, because if you see Kwanzaa, they have the candle like the Jewish religion. But they only have 6 candles. And they start today, and it goes until January 1st. It's only 49 years old celebration. Started in the 60s. So it's only 49 years old. And Kwanzaa basically is bringing pride and awareness of the African culture. And so it's 6 candles, and each candle stands for some principle. And so when the people that celebrate Kwanzaa, and many people have both a Christmas tree and a Kwanzaa candle. And Christmas, of course, ended a few days ago, but then Kwanzaa starts today. And it goes on until January 1st. And each day, just like in the Jewish religion, instead of exchanging a gift, they look and acknowledge each principle as the day go by. And there's 6 principles that they acknowledge. So each candle different from the Jewish religion, because the middle candle is basically the candle that is used to light the other candle. So it has no meaning to it. But in Kwanzaa, all candle has a meaning to it.
Okay.
Yeah.
Thank you. I just got my little education. So 2016. So what are you thinking about 2016?
As I was giving the bonuses to my staff and except to myself, I was, being grateful for all the new people we have acquired in the company, people that have joined the family of AGI. In all the different departments, and how important they have become, from the front desk all the way to administration. We have, lost Stanton, who was like a son to me. So we have some loss in the family of AGI. My mother-in-law passed away, which was, from both sides, was the oldest person that we had. So we have some lost, but usually God says when somebody dies, somebody else is born. I remember when my father-in-law died, my younger daughter was born, Talin. My second daughter was born, Talin. So, this is a cycle of life. So moving forward, the road ahead, I hope, and I pray to God that give us strength to grow as much as God feels that we should grow for 2016, that we continue to provide good service for the community. I have invested so much into the company to increase the quality of care that we provide. We just bought a new equipment for the dental department, and it will do the crown. So when you go for a crown, usually they'll give you a temporary, and then it goes to the lab, and then you come back, and then they give you the permanent, and then they start fixing it, and if they make a run, they have to send it back. with this machine, we will be able to do the permanent crown within 24 hours.
Amazing.
Really? Yeah. So sometime within the same day. So if a person going on a cruise or flying or have an event going on, going to a wedding, what have you, and the crown breaks or they need a crown, we will be able to do that and do the permanent crown that they will have for the rest of their life within 24 hours. And, if the procedure get done early in the day, they can have it on the same day. So, we continue to improve and one of the things we've been working on is, on sleep apnea. Sleep apnea, after you go through all the procedure of the diagnosis and all of that, the answer used to be a mask that you look like somebody from outer space. And compliance was an issue when it came to the mask. But nowadays we have a device, a dental device, that we can put on the patient and improve their sleep apnea without the mask sometimes. Sometimes they need both if it's really bad. But if it's moderate sleep apnea, most of the patients respond just to using the device in their mouth.
It goes in the mouth, I think.
It's a mouthpiece, and it takes the jaw and pull it forward so that your throat doesn't close on you when you are sleeping, and you continue to bring oxygen to your brain, and you don't wake up tired. You wake up rejuvenated and full of energy. Which is the same thing that the mask will do, but the mask is a big machine, noisy and difficult to wear. You have to wear really tight around your mouth so the air does not escape, because
it scare my dog who sleeps with us.
Everybody. Bill will say, arrivederci, Anita, going to another room.
Another woman, right?
Yeah, exactly.
So how can you have sex when you have one of these things on your face?
Well, the device, with the mask, of course you cannot, so it becomes troublesome. Not only that, when you travel, you have to carry that with you. So if you're going to go and visit a loved one for the holidays, then you have to pack your mask and all your equipment
mask
and bring it with you.
Oh, and I can picture if you put it, then you have to go through
And if you
security.
go to a cabinet.
You have to go through security and they pull out all this stuff. What is that? That's my mask. Your mask. What are you going to do?
If you go to a cabinet that's no electricity, then you cannot connect the equipment. But with the device, you don't need anything. You just put it in your mouth. You're going to have sex, take it off. Doom, put it back on, go back to sleep.
Oh boy. Okay. But you're right. But sleep apnea is very serious and people do need to take care of it. And I'm glad that you're doing that with
in the medical side, we have, expanded this year tremendously with a home visiting program. So much so that, we are now covering Miami, Broward and West Palm Beach. So we are tri-county with the home visit. We have several nurse practitioners and, Dr. Richard is one of the main doctors that work with me on the program. And they are basically, doing a great job, and the, medical assistant department have grown, so we can accommodate them and make sure that the patient, when they come to the office, they don't have to wait so long. We had a young guy that came in, and he delivered for a restaurant, an Italian restaurant, and he came in because he pulled his back and needed medication. So somebody said, go to AGI, go and see Dr. Mencia. So he came referred by other patients. And when he came in, they gave him the paperwork, they took his picture for the for the chart and what have you. And as he filled out the paperwork, he's not even done, and they're pulling him right into the room. And he's in the room, two nurses jump on him and started taking the blood pressure, taking the pulse.
Was he cute?
He was cute.
Oh, that's why,
he's cute. Two nurses jump on him, one taking the blood pressure, one taking the pulse. I walk in with my student, and then one of the nurses already writing on the chart, taking the history. He say, my God, you guys are so fast. I've never been to a doctor's office that they are so efficient, so fast.
True.
I say, I'm changing the name from AGI to Jimmy John. Jimmy John.
Oh, I love. Oh, that's very funny.
Yeah.
Well, no, but it's
So
true.
instead of calling the fire department, we call AGI.
AGI. Well, listen, I'm glad you brought that up because when I was there, I was talking with some people. One of your patients. It was such a nice thing, and they knew I was there for a flu shot. And the assistant kept rushing. Come on, you can't stop talking because I have to get the shot. Wait a minute. No, you have to come right away because she said you can't keep this out. You're supposed to be, it's refrigerated. And,
right.
And I mean, she was really rushing me to get this thing.
Get it done.
So, I mean.
And then after that, we let the patient socialize and do whatever they want to, but we do our job. We don't, abuse their time. We don't misuse nobody's time. So we make sure when the patient, after that, sometimes they say, oh, could I have a cup of coffee? Could I have this? And they start chit-chatting and what have you. And they go to the front, they go upstairs,
Yeah, it is very friendly, Dr. Mencia. You have created something that is unique, and I have told people that. And it is a lovely thing when people come there. They may feel very badly and, but when by the time they leave, they've been taken care of. And a lot of people don't feel that way about doctors when they leave. It's not a very pleasant thing, unfortunately. And I don't understand. I guess, and sometimes the doctor is wonderful, but he doesn't realize what his staff's like outside.
Absolutely.
And people are afraid to go tell him because then the people will do bad things to them.
Right.
There's a lot of fear with older people, especially.
No, and a lot of times my patient, they say, can I talk to you alone? And they get scared, the staff gets scared. And most of the time it's just personal stuff. But at times they say, this person's attitude wasn't right, or I don't know if he or she is having some personal problem, but usually, everybody smile by that person. I say, okay. Then I will go, let a day or two go by, and I will pull everybody in and try to educate them. We observe, as consumer, we observe. And I try to educate my staff, if we work at Macy's or, Bloomingdale or any 5-star hotel, our job is, to be pleasant and smile. And I say, when a person comes in sick, they are here because they want to be helped. You still need to be pleasant. You still need to smile at them, And a lot of times, patients come in and they say, Dr. Mencia, I wasn't feeling that great, but after I spoke with you, I feel so much better. And I tell them, you think that's because I'm a magician? It's all of us together. Because if I come with a good karma and a good aura to help you, but everybody else around me is negative, you're getting mixed messages.
It all starts with the receptionist.
Exactly. It starts with the receptionist and you end up with the receptionist. That's one of my comments to them. You are the first one to greet the person. You are the last one to say goodbye. And many times, Patricia is such a wonderful woman, check out. Many times she'll, either I remind her or she'll remind me. We are like, husband and wife, they are running the company. And she will remind me, oh, Dr. Mencia, you remember so-and-so went to the hospital. We have to call and see how they're doing. And,
nice.
or vice versa, I will say, remember so-and-so, call and see how that person is doing. And, so for 2016, I think we will continue to have, we got help, a wonderful staff, and we have to restructure something, I guess, with dental department, but, I will do my best to make sure that we continue to serve the community in both medical and dental.
Right, people to know now that you do have 2 offices. Because when I first met you, of course, it was commercial and office, but now you're in Palm Beach County, and it's a beautiful office, and you do everything there, medical, dental. And I have to say, though, that I want to go back to something, that now you now are open in both centers on Saturdays. Before it was just only
center.
And there's just a need
both
for that,
of them.
Isn't there?
Yes, absolutely. Well, imagine a lot of people, if you work and you have a dental problem or a medical problem, you have to take time off from work. And I feel it with my staff. When my staff take time off, we feel that we're missing somebody. We don't have excess employee to say, if you take time off. Don't worry about it. We all going to be okay. No, we are not okay. We miss you there. We all have a job to do, and we all sort of codependent with each other. So having everybody there is important to us. So when you take time off from your company, they're going to miss you. And sometimes you feel guilty taking time off. So if you work Monday through Friday, you say, you know what, I'm going to go to the dentist, or I'm going to go to the doctor on a Saturday. So I get my personal thing taken care of without taking time from my company.
No, it's a wonderful thing, but even more importantly than that, and we don't stress it much, maybe you have some stories about it, home visits. I told you years ago that home visits for me, for the elder population, is just extraordinary, and so few offices do this, Dr. Mencia.
Yeah. I was talking to one of my dentists, this weekend. I'm lost because today's Saturday.
That's true, I know. It seems like it's the weekend. Yeah. That's right. We were off for the holiday.
I feel like today's Monday.
Right.
So
no, you got to go
this
to
week,
the bed.
Yeah, I was talking this week to one of my dentists, and I was mentioning how my dream had been to build this center with all these components, and I don't want to let it fall apart. Of course, I have to get a lawyer to help me out and tell me what would be the legal way of making sure that we keep everything we have. And everything that had been structured in the company, of course, is through the blessing of our corporate lawyer, who have structured everything, and he consults with a Medicare lawyer to make sure that what we're doing is always, legal and right. Doing the home visit is part of being a geriatrician. You can not be a geriatrician and decline a person comfort care toward the end of life. Tell the patient, if you go into hospice, that's it. I'm done with you. Now somebody else is going to take over your life. I believe that once you become a geriatric doctor, you should be there to serve that patient until the end of life. So when a person, for whatever reason, get homebound and they need medical care, if it's my mother or my father, may they both rest in peace, I want the best to come to the house to take care of them. I want to do the best at home, as if it being done at the office. So when we do the home visit, we pack ourselves like if we're going to war. We have all the equipment that we can carry with us, including electrocardiogram, ultrasound, everything that we have in the medical department, and some of the equipment that we have in the dental department had been obtained with the thought of home visit, so that we don't avoid the patient from prevent the patient from getting the same services that we can provide in the office.
Dr. Mencia, it is so difficult for an older adult to get to the doctor's office, and they either have to wait for their children or they have a home health aide. And I just want to talk about that. A lot of people have been relying on home health aides.
Or they rely on transportation, some form of transportation to get them there.
Yes.
Do you know how many times I feel bad about leaving my office? I will make sure that, Ina or somebody in the office stay in the office just because we have a patient that has not been picked up and it's by 5 o'clock.
I know that. I've seen that.
And
right.
we, they sit there and we say, can we get you some water? Can we get you this? And, oh no, they don't want to bother you, but we feel like, we cannot leave you here.
I once took one of your patients, you don't know that, took one of your patients home.
You did?
Yeah, I did, because I was there and they'd been waiting for an hour for transportation.
That sounds like you.
And I said, where you have to go? And they told me, and I said, I'll drive you by there.
Oh.
No, because I feel the same thing
course,
that you do. It's like, so when an older adult has, at the mercy of the transportation system, and sometimes they have to transport a lot of people. But so some of those people really are home and they cannot get to the doctor.
Right.
And I want to go back to the home health agency.
And we do that. We do that with with the dental patient, sometimes our dental department will go to the house, pick up the patient, bring them to the office, have them be taken, and then we drive them back. But yeah, before we go to the home health agency, one of the pieces of my dream center is a transportation system that will pick up and deliver the patient, and I think that would be a more complete center, but we are not there yet.
No, it's an expensive, it's funny. The Volin Center has 28 buses.
Wow.
Because that's transportation is the worst thing for an older adult. But what I want to say about the home health, because there are a lot of people who are being cared for by home health agencies, but they don't get to the doctor. And there is a difference, and I'm just going to say this.
There is a big difference.
It's not that they don't do a good job, but they don't know everything. And they need to make sure that a doctor is involved. And so that's why having home visits are important, because maybe the person who's there, whether they're a nurse or whatever they are, you're a doctor.
Right.
And you need to be there to say what they're doing. Maybe their medication is not right. Maybe things are not right. And so please do call AGI and make sure that you have the home, have the Dr. Mencia's office watch over you, even if you have home health agencies.
Yeah, because it's very different. Usually when we go there, it's either a nurse practitioner or an MD that is going to the house to make sure that all the medications are right. And, we depend on the home visiting nurses also. We use them a lot. If the patient has a wound, we want the home visiting nursing to come in and do the wound care. If the person needs a bath or something like that, we get the aide to come in and do something. And we try to get everything through the insurance without the patient paying as much as we can get. If the patient needs equipment or needs physical therapy, occupational therapy, speech therapy, whatever the patient needs, we can write the order for one of those home visiting companies to come in and do that. But you are absolutely right. You need a nurse practitioner or a doctor that supervise your care, because a nurse is not qualified to do that. They are qualified to provide service upon the order from a physician or a nurse practitioner.
That's really true. And of course, I'm the one that suffered with this. And so how many baby boomers think that they can just say, okay, we're going to have a home health agency take care of mom. And it could be just a companion. Who knows what it is? And it's not enough.
Mm-hmm.
People
we had a case a couple of weeks ago that, my staff went to see the case, and they called me. They said, Dr. Mencia, we need to consult with you because the daughter wants us to go in, but the patient is so reluctant that she has her doctor for 25 years and she's not losing her doctor. So I explained to the nurse practitioner, I said, well, explain to her that we can do one visit, do an assessment, try to see if we can help. Maybe the doctor is doing everything right. Maybe there's no problem and we will walk away. But to please her daughter, why don't she just let us do one visit? And if she say no, it's no. But to let us do just one visit and do an assessment to please her daughter. So she agreed to that. Now the doctor have not seen her for years.
Oh, I know.
And he basically was depending on the visiting nurse to say what medication the patient needed. So the patient was in 2 or 3 of the same medication, one with the brand name, one with the generic name, and 2 or 3 medication double, both in brand and generic. For example, thyroid medication. And the lab wasn't really being done because the doctor doesn't do home visit. And, we called the doctor and we explained. He said, you know how many times I've explained to this lady that I don't do home visit. I cannot keep treating her like this. But she's stubborn. She continued to do like this. So I said, well, you're going to kill her if we continue this way. So he said, okay, I'm going to give her 30 days notice. That's the only way she's going to let go of me. And I said, no, I don't think it. So then I did the visit. And I went there and I said, listen, we are geriatric center. We specialize on people your age with your condition. So we are here to to explain to you, because you are an intelligent woman, what you're going through. So we explained to her that her craziness, quote unquote, that the aide was saying that she was having is not her fault. It's the fact that she's been over-medicated with thyroid medication. And I say, when you are agitated and all of that, it's this pill that are doing it to you. So I open my phone and I show her, you see this medication for your thyroid, for a sluggish thyroid. So I close that and I open the other medication. You see that medication, what it says there? The same thing. You are taking 2 pills with different names for the same thing. Then we went for the blood pressure medication and explained that to her. And, because of the over-medication, then she was on polypharmacy. She was getting medication for her quote-unquote craziness and for medication for her palpitation. And I say, if we do this to you, we can take you off from all this medication. There's nothing wrong with your brain. It's just your medication is it's killing you. And that's why your doctor been telling you that he cannot continue like this. And she accepted us. And if you see her, the lady that was bedbound, now is able to sit on a wheelchair. She doesn't need she was like dead weight for the aide. Now she's a person that can help the aide, help her.
Dr. Mencia, multiply that thousands of times.
Absolutely.
This is happening everywhere.
Everywhere.
I have to give your phone number.
And we have patients dying prematurely because of this.
I know. That's why it's a very big subject. Please call for an appointment at 954-489-1345 in Fort Lauderdale or in Boynton Beach, 561-270-6494. We'll be back after the 7 o'clock hour. We have Dr. Mencia for another half an hour today, which is wonderful. But it's AGI Medical Dental Centers, and also the website is agifl.com. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.